COVID-19 diseases and renin angiotensin system, RAS. Translation of the presentation done by Dr. Jean-Marc Sabatier, PhD in Cell Biology and Microbiology, HDR in Biochemistry, Director of Research at CNRS, France. COVID-19 diseases caused by overactivation of the renin angiotensin system, RAS, induced by spike protein overload by vaccine or strong infection. Research area of the Dr. Jean-Marc Sabatier. Drug design and chemical synthesis. Optimization of peptide structure, conformation. Peptide and protein engineering. Peptide-based in vitro assays. Toxinology and microbiology. I am going to talk about the COVID-19 diseases which are caused by the overactivation of a ubiquitous system called the renin angiotensin system, which is present in all organs. It is an important system of the organism since it controls the renal, pulmonary, and cardiovascular autonomic functions. It also controls innate immunity and the various microbial flora. At the level of the renin angiotensin system, you have first of all the angiotensin again, which is produced by the liver. And you have the kidney, which produces an enzyme which is called the renin. This renin will degrade the angiotensin again to form angiotensin 1, which is a hormone of the organism. In turn, this angiotensin 1 will be degraded by a receptor called ACE, which is the angiotensin 1 converting enzyme, which is highly expressed in epithelial and endothelial cells, particularly in the lungs, and in the entire vascular system, since this receptor lines the inner surface of blood vessels. So, the ACE receptor will degrade angiotensin 1 into angiotensin 2. This angiotensin 2 normally is degraded by another receptor called ACE2, which is the enzyme of conversion of angiotensin 2. This degradation will produce angiotensin 1 to 7. When there is a viral infection with the SARS-CoV-2 virus, the spike protein of this virus comes to recognize the ACE2 receptor and thus hinders the degradation of angiotensin 2, which is found in excess. This excess will overactivate its own receptor, which is the AT1R receptor. This is the receptor that is responsible for COVID diseases. In particular, this receptor when overactivated will cause headaches, confusion. It can also cause inflammation, insomnia, hypogeusia, cerebral vascular accidents, myalgia, encephalopathy, dizziness. In the liver, for example, this overactivated receptor will cause an increase in bilirubin and aminotransferase levels. It will be able to cause microvascular steatosis, as well as degeneration of the hepatocytes. This overactivated receptor is also responsible for oliguria, hematuria, proteinuria, decreased blood pressure, acute chronic kidney injury and renal failure. It can cause nausea, vomiting, diarrhea, anorexia, abdominal pain, and infections of the gastrointestinal tract. Dry cough, sneezing, rhinorrhea, sore throat, dyspnea, pneumonia, acute respiratory distress syndrome. Heart failure, myocarditis, atrial fibrillation, acute coronary syndrome, hypertension, endothelial dysfunction, microvascular diseases, thromboembolism, fibrosis, inflammation, palpitation, arrhythmia. Decreased pancreatic blood flow, inflammation, fibrosis, and insulin resistance, and thus, diabetes mellitus. Among the pathologies described, some can be fatal in the short term. These are the pathologies that are underlined in red. This includes cardiac disorders and inflammations. Among the cardiac disorders, we find the acute respiratory distress syndrome, inflammations such as myocarditis, pericarditis. There are also thrombosis, i.e. the occlusion of blood vessels, and then, strokes. Finally, I would like to remind you that the dysfunction of the renin angiotensin system is responsible for the macrophage activation syndrome, which is called MAS. It is also responsible for mast cell activation syndrome, MCAS. It is also responsible for the overgrowth of colon bacteria in the small intestine, which is called SIBO. And it is responsible for hypokalemia, i.e. a deficit of potassium in the blood, which can be responsible for very severe pathologies.